Injections, vaccinations. Svetlana Georgieva is getting ready for the day.
I expect 30 vaccinations today. It's different every day. It depends on the people.
30 shots, that's not much. People here are skeptical. Hardly anyone comes to the vaccination centers, so Svetlana and her colleague Chavdar are hitting the road.
We need more people to get vaccinated. Bulgaria has the lowest vaccination rate in the EU. We need much more to achieve the threshold of at least 70%.
It's nowhere near that in Vratsa, a small rural city in the poorest region of the country where about 30% have had the jab. And that is considered a lot. The national average is currently about 25%. Svetlana and Chavdar have been on the road for months to change that. They went to various towns and villages, but hardly any people were willing to get vaccinated. Now they are trying something else. A lot of people come to this supermarket. Chavdar is full of hope.
New discounts begin today, so hopefully more people will come and get vaccinated.
Sales in the supermarket are attracting customers, but the vaccination van is less attractive.
I'm worried it's not been sufficiently tested. It's still in process. Compared to other vaccines, for example against tuberculosis that last a lifetime, this is only for 6 months.
I've seen videos that say people who get vaccinated get some kind of a chip inserted.
False information like this is annoying to those who got vaccinated.
I don't get it. So many people have died. Why don't they take matters into their own hands and get vaccinated?
Svetlana and Chavdar know the wild theories circulating among anti-vaxxers. They try to correctly inform the skeptics.
I've tried to convince them. I also have close friends who didn't trust the vaccine, who lost relatives, and regretted not listening to me.
Finally, after more than an hour, the first patients begin to show up.
Vaccination?
Third dose.
Come in. We're happy for any patient.
To change the overall vaccination rate, though, the unvaccinated need to come. Some anti-vaxxers eventually end up here, fighting for every breath at the local hospital in Vratsa. Three doctors care for about 40 COVID patients. Even among medical staff, only half got the jab. That means just a few can work on the COVID ward. Peter Karemchiev, who is in charge of the hospital, tries to explain what he himself struggles to understand.
Maybe it's connected to the historical and behavioral nuances of Bulgarians. They find it hard to trust anyone. I think we need a better campaign to educate people, spearheaded by politicians.
Chavdar and the vaccination team maintain that the government should increase local vaccination drives. But there's not enough healthcare staff, they say. Hundreds work in Western Europe for better pay and better prospects.
We don't feel valued because despite all the work we put in, people refuse to get vaccinated for some reason.
They wanted to inoculate 30 people today. In the end, it was less than half that. Some of the doses will be disposed of, no longer valid. They will be back out tomorrow morning again, though they say it's increasingly hard for them to stay motivated.